So with the aging population and the increase of diagnosis of dementia that comes along with it, and right now we definitely need point-of-care biomarkers to detect it as early as possible, which are not there right now. There we need some sort of solution, and we try to cover this solution in our symposium.
Compared to the controls in studies, the incidence of cataract surgery is much, much reduced. And the reason for that is primarily because the system fails. And it's up to us as a community, all of us together, to work out how we're going to change that.
Consider when you have a patient who has both dementia and cataracts, and it is important to rely on communicating with the caregivers, with their family, with people who see how they function, asking more pointed questions, like gently getting them to feel comfortable in sharing those things with you is really important. But if we have more advanced cognitive impairment, where the patient really is maybe a little aggressive or not able to cooperate and understand, then I think general anesthesia is a good option for those patients.
We were taught that a general anesthetic would make the dementia worse, but a little cataract operation, which is a very minimal anesthetic involvement, just to keep them quiet whilst you do the surgery and you do both eyes, that's now been shown not to worsen dementia after surgery. The other thing to say is, a lot of people say, well, obviously wearing glasses is a problem. Why don't we put multifocals in? The problem with multifocals is they rely on the brain to work. However, if the brain is required for neuroadaptation to make the multifocals work, and the brain is failing, which is what is happening in dementia, that is not going to work.
Another part of the procedure that you want to consider preoperatively is what's going to happen with the management of the patient postoperatively. So again, involving the caregivers, the family with that discussion, simplifying the regimen.
There's definitely a space for dropless cataract surgery, like drug delivery systems, but they are not available in Europe right now. They are unavailable in the US, but what we can do, for example, is a subconjunctival triamcinolone injection and with antibiotics. There's a whole bunch of publications out, including reviews and meta-analyses, showing that the great benefit of cataract surgery in dementia patients. The problem is not the evidence, it's just the access to care of these patients. There are no programs in any country, so nobody's reaching out. Even optometrists or opticians are not advocating that at all. So more or less 50% of all cataracts are undiagnosed in these patients.
So a significant amount of people who are living with dementia are walking around with completely unmet visual healthcare needs. At least a third of them have got vision that could be improved by a simple cataract operation. And the question we have to ask ourselves as a community is, why is that happening? If you have a diagnosis with dementia and you come into my clinic, we don't want to wait till you get worse, because your dementia will stop you from coming back to us. So take out that cataracts right at the beginning rather than later on. And what we have to do as a research question is ask, how can we find data and strategies to change that problem? The phrase I use that always works is fix the roof while the sun's shining.